Skull and scalp examination. Firstly, look for skull shape for any abnormality like microcephaly, macrocephaly, brachycephaly, dolichocephaly, and plagiocephaly. Then palpate the anterior and posterior fontanelles after slight head elevation, and the baby should be calm. For bulging fontanelles, depressed fontanelle, widely opened fontanelle, or prematurely closed fontanelle. Normally, the anterior fontanelle is diamond in shape, 2.5 cm length and width, flat or slightly depressed, while the posterior fontanelle is triangular in shape. Then palpate the suture lines, which are coronal, sagittal, lambdoid, and metopic sutures, and we expect to find molding in the first few days after birth, especially after normal vaginal delivery. Also palpate for any skull swelling like capsuccedium, encephal hematoma, or skull depression due to skull fracture. Finally, don't forget to measure head circumference, which is explained in a previous video. Face examination. Firstly, look to the face for any dysmorphic features like epicanthal folds, hypo and hypertelorism, and facial asymmetry due to facial nerve palsy. Then look to the eyes, which can be opened spontaneously by holding the infants up and tipped forward and backward, while the forced eye opening is wrong way, so we should avoid it. Looks for pallor in lower conjunctiva and jaundice in upper sclera. Look for conjunctival hemorrhage, cataract, congenital glaucoma, and don't forget to do doll's eye movement, in which the neonate's eyes moves in opposite direction to the examiner hands. This means a normal functioning brainstem, while if the eyes movement in the same direction or remain central, this means a brainstem dysfunction. Examine the ear for abnormal shaping of the external auricle and the presence of preauricular pits or skin tags which may be associated with renal anomalies. Also check the position of the ear whether it's normal or low-seated by drawing an imaginary line from the medial canthus to the ear, which should be passed through the upper one-third of the ear, and the ear that located below this line considered as low-seated. Examine the nose for patency by blocking each nostril in turn and checking that the infant breathes through the other. Examine the mouth for cleft lips and inspect the palate for cleft palate. Also, you should palpate the hard palate with your sterile little finger for submucosal cleft. Also, inspect for high arched palate, natal teeth, tongue tie, epichtean pearls, ranulae, candidiasis, and oral ulceration.